Vasavi Hospitals is the only trust hospital in Bengaluru to have a robotic surgery department. This goes in line with our motto of keeping patients first. Originating in the early 1990s, robotic surgery has evolved into a cutting-edge field, offering precise, minimally invasive solutions that enhance control and improve patient outcomes.
Hello everyone, regards from Vasavi Hospital. My name is Dr. Venkatesh Rathod, orthopedic surgeon. Since the robotic surgery has been in the news recently, so what is this robotic surgery? So use of programmable devices to perform wide variety of surgeries, and these are not intended to replace the surgeon but to assist the surgeons. So what are the advantages compared to the conventional surgeries with robotic surgeries? So one is the incision taken is much more lesser and the precision is much more better. Recovery time is faster and the cost of the surgery is slightly more than the conventional, but it is worth the cost, and it requires a certain amount of training before undergoing the surgery. So the indications for surgery for robotic knee replacement and hip replacement are very similar to the conventional replacement surgeries. But in addition to that, the complete array of indications are complex deformities of the knee, post-trauma where the implants are there in the knee, and implant failures. These are the wide variety of applications for robotic knee surgeries. And you can see that the standard pre-operative investigations are done before the surgery, and we do a CT scan which gives us a absolute deformity where exactly, and planning can be a patient specific and anatomically planned. So because of the precision which was not there in the conventional knee, robotic knee has an edge and definitely has advantages with it.
Surgeons train extensively using simulators, and the technology now supports remote operations and integrates artificial intelligence for improved outcomes.
Srivatsa is my name. I'm an orthopedic surgeon at Vasavi Hospital. I specialize in surgeries of shoulder and knee joint. So during surgery, we attach trackers to the patient's limb and then re-register the landmarks. The landmarks are then matched with what the robot has already been fed with, and then we plan the cuts according to the desired alignment and the desired soft tissue tension. And after the planning, the cutting tool is attached to the robotic arm, and the robotic arm aligns itself to the limb, and then the cuts are performed. Following the cuts, the final implantation of the prosthesis and the post-operative care is similar to what we do during a conventional knee replacement. The advantages of robot is that it is more precise and accurate. And the other thing is we can plan the ultimate alignment and the soft tissue tension before we do the actual cuts.
The benefits include faster recovery, fewer complications, and ongoing innovations that continually expand its capabilities.
In my experience of around 2000 knees that I have done conventionally, and for the last 30-40 knees that I have done robotically, I find the patients are more comfortable immediate post-op. The physiotherapist says their cooperation with physiotherapy has been much better than the conventional surgery. The range of movement that I see at the end of 3 or 4 weeks of follow-up has been very encouraging. And many patients have expressed satisfaction that the pain and the result was much better than what they anticipated. And I hope this immediate good post-op result results in a very long-term, pain-free and functional result for the knee.
At Vasavi Hospitals, we are dedicated to delivering top-tier care with our advanced robotic surgery systems. We are committed to leveraging the latest innovations to enhance our patients' health and well-being.